to Home and Family.
And we're sharing the silent signs of heart attacks in women that can be easily missed.
Welcome back, everyone. February is American Heart Month, and here with the latest on what every woman needs to know to detect and prevent heart attacks. This is very important. Please welcome back the medical director of the Joan Tisch Center for Women's Health at NYU Langone, Dr. Nieca Goldberg. Welcome back, Dr. Nieca.
Thank you.
Thanks for being here.
We love it when you're here, but it's very important that you're here this month
That's right, to continue to raise awareness about the #1 killer in women, because 200,000 women every year die of a heart attack in our country.
I mean, it's an epidemic.
It is an epidemic, and sometimes women don't even realize that they're having the symptoms of a heart attack.
Many times we don't realize.
The #1 killer in women.
Yeah.
That surprised me when I read that, Dr. Nieca.
Nearly every minute a woman can die of a heart attack in our country. So the best way is that we get ahead of this and prevent that first heart attack.
And unfortunately, like you said, a lot of women have no idea because it is so different than men.
And on that note, I know we were talking about this a little bit off camera, the signs can be quite different for women.
Right, so everyone knows the Hollywood heart attack, the crushing pressure in the center of the chest, radiating down the arm, going up the neck, the cold sweat. But sometimes women don't have those symptoms. Instead, the pain or the tightness can be like an elephant is sitting on your chest, but it's lower down in the chest. So sometimes women quickly grab an antacid because they think it's acid reflux. Or they're unbelievably exhausted, feel as though they can't even walk across the room, or short of breath, feeling as though they've run a marathon but have not even made a move. And you know, the symptoms seem subtle, and oftentimes in practice, women ask me, well, Dr. Goldberg, how do I know whether or not I should go to the hospital or call you or just think it's a bad day at work?
Yeah, how do you know you're just not tired? Because a lot of this, like sometimes you're short of breath, you're having a long week.
Here's some really important tips. When you're actually having a heart attack, the symptoms can wake you up from your sleep, and the tightness or pressure in the chest or shortness of breath is so severe you may not be able to speak, and you feel lightheaded, like you're going to faint or completely pass out. And oftentimes women say, oh, I'm not sure if this is a heart attack, and they'll go online and Google the symptoms. Don't do that. That wastes time. That wastes a lot of time.
Why do you think we as women are so slow to recognize or even to admit that we may be having heart problems?
Because women actually are very good at multitasking, and they're more worried about taking care of their families, getting through their work, taking care of stuff at home, worrying about even their grown children's problems.
That's the truth. I mean, it really is. I almost think that your threshold for pain might be a little bit higher than us men, too. I don't know if that's true or not.
We do deliver children.
But that's right. You know,
I mean, there's that.
There's childbirth.
Cameron, that's a very good point. Women's pain threshold is higher than in men.
Interesting.
And sometimes they may not even recognize that. But you know, I think one of the things that women really need to understand is if you don't feel well, you need to get checked out. About 6 weeks before the actual heart attack, women have more subtle symptoms. What they do is they walk a few blocks and then they feel tired or a tightness in their chest, and they stop and it goes away. That's the time to call your doctor. But when it's waking you up from sleep, or you feel as though you can't do as much exercise as before, or it comes on completely at rest, then you need to call 911.
Okay, I was just going to say what the first thing we should do. And it's interesting because we were talking about this off camera too, that a very good friend of mine, somebody that I worked with, was recently on a talk show talking about these exact things that she went through. I'm talking about Susan Lucci. It's okay saying her name because she's already been out there talking about it. And it's specifically that. And she said in her interview that she was going to go home and just lay down. But what is the first thing we should do? And you just said it.
You need to call 911. And another mistake women make that I hear about in practice is oftentimes when they get symptoms, they chew an aspirin and then see they wait to see what's going to happen if they get better. Aspirin is one of the many things we give in the setting of a heart attack, but if you think you're having a heart attack and about to take that aspirin, you should also be dialing 911.
Got it. So have the aspirin, but dialing 911 or get somebody to get you to the hospital.
So do not lay down and think you need to rest because you may not get back up.
That's right. In fact, in every year when we look at the statistics of heart attacks in women, that women are more likely likely to die from their first heart attack compared to men.
Oh boy. Well, it's probably because we wait so long and we don't even know what's happening.
You know, women delay going to the hospital by about a half hour.
For a half hour? How about a half a year? I mean, no, I will get to it because you've got the appointments for the kids and the husband and this. We're always last. It's true. Now, what are some things that we can do as women today and you know, just lifestyle changes to reduce our risk?
We take for granted that if we change certain things in our lifestyle that we can actually reduce heart attack risk by 80%.
80%?
That's right. So one of the most preventable risk factors is cigarette smoking, quitting smoking, because smoking triples a woman's risk for heart disease. High blood pressure. Nearly half of people in our country have high blood pressure, and it's not adequately treated. Only 1 in 5 people on blood pressure medicine have controlled blood pressure. High blood pressure raises risk for heart attack and stroke. What can you do about lowering blood pressure? You can start a diet by lowering salt, eating a diet that's rich in fruits, vegetables, whole grains, low-fat dairy products, and physical inactivity. People are couch potatoes. Only 21% of women have adequate exercise.
That's it? Really? Only 21%?
It makes such a big difference, doesn't it?
It makes a big difference. And all you have to do is take a moderate to quick-paced walk a half hour a day for the bare minimum. If you want to lose weight, you're going to have to exercise longer.
And you also say stay away from sugar.
Oh, that's exactly what I was just going to mention.
So, you know, we
Yeah.
always focused on lowering fat and eating healthy fats.
Right.
But sugar, you know, sugar raises risk for obesity, which leads to type 2 diabetes, a really big risk factor for heart disease. You wouldn't believe this, but I had a patient who said to me, I'm eating all healthy things, Dr. Goldberg, and I can't understand why I can't lower my glucose. Then I found out she was drinking a lot of soda. You're not going to believe this. She quit drinking soda and lost 30 pounds.
It's like that.
Whoa!
It's sugar. It's all the sugar. I mean, it's so good that you're at this point. A lot of people don't realize
it's very important. Thank you, Dr. Nieca. Thank you for all this information. It's very important. Thank you for being here. To connect with Dr. Nieca, you can go to her website at drnieca.com.
Absolutely. Great to get that word out.